There were 35,054 cases of COVID.
17,636 were diagnosed.
6,781 new cases.
A grim record no one wanted to break. Almost 65,000 new infections across Australia today. In New South Wales and Victoria, around 1 in 3 of those who were able to get a PCR test are positive.
We had a 2% positive test rate in December, and just in the few days in January, this proportion has gone up to 30%.
But with new restrictions on exactly who's eligible for the gold standard test,
if you are not required to get a PCR test, please do not line up in that queue. We need people who are feeling unwell, who are classified close contact to get that test.
And the dire state of rapid test availability.
For the next few weeks, we do anticipate there will continue to be a lot of tension in the system when it comes to the supply and demand of those tests.
Some experts are warning the official number of new cases could be hiding the real figure in the community, which could be up to 10 times higher.
At the moment, there's so much around that if you're positive on a rapid antigen test, the chance of you being a true positive is bloody high, to be blunt. The pressure on the health services in the next few weeks is just going to be phenomenal.
So, is today's sky-high number of cases just a shadow of the real amount of COVID out in the wild?
Respected clinical epidemiologist Professor Nancy Baxter is the head of Melbourne University's School of Population and Global Health, and she joins us now. Nancy, just to begin, what's your reaction to the Prime Minister's about-face on free rapid tests today? Given the explosion in numbers, did he have any other choice?
So I think that this was the right choice in terms of providing some access to people that can't really afford it. But, this was really the absolute bare minimum. He was really kind of came in very low in terms of any kind of ambition to provide, access to these kits to the Australian people. And it is well below what many countries around the world are doing and have accomplished for months.
All right, well, let's talk numbers now. Just how high do you think the real number of COVID cases could be right now in Australia?
Well, definitely hundreds of thousands. I think it's definitely in the hundreds of thousands we have cases. Is it 10 times the number? Is it 5 times the number? Is it 3 times the number? It's hard to know. But, they've really restricted the groups of people that can be tested. So we're not testing asymptomatic people that we previously considered close contacts. And these are people who had a real chance of getting COVID, right? So you're working in McDonald's and you're in the kitchen and you've been working beside someone who ends up being a COVID positive case when they were infectious. Well, guess what? You are a close contact and you have a significant risk of having contracted Omicron, but now you're not eligible for a test until you become symptomatic. So we're clearly missing a lot of people, particularly since the change in who is considered a close contact to just household contacts. I get that we needed to do that, but what it means is we're grossly underestimating the number of people who actually have Omicron and are walking around with Omicron now because they don't even know it.
Nancy, if the numbers are way higher than the statistics we're seeing and the hospitalisation rates are what they are, does that mean that Omicron might be actually much less severe comparatively than what we initially thought?
Well, so it does appear to be quite a bit less severe, but that's a combination of things, right? So it's both because it seems to be in itself less severe. So, as compared to other variants, if they went head to head, it does seem to be less severe because it seems to like to stay in the throat versus go to the lungs. But the other main reason that it seems less severe is because, it's infecting people who have previously been vaccinated and or have had COVID before. So people that were previously protected. So it's kind of expanded the reach of people that are susceptible to Omicron. They still are protected against severe disease. So that's part of the reason why it's seeming mild as well. But, as I've said before on this program, even if it's only a small percentage of the cases that get sick, a small percentage of a huge number is still a major impact, can have a major impact on the healthcare system. And that's what we're seeing now. I mean, we have record numbers of hospitalization. As a percentage, it's much lower than with Delta or with Alpha or with, a 1.0 COVID. But you still have record number of hospitalizations right now in New South Wales.
So we've all heard conversations going on in the community, Nancy, about if Omicron is milder, then let's just maybe throw caution to a wind, get it and get over it. I imagine you're not condoning those kinds of thoughts.
Well, number one, if you did want to do something like that, I would suggest you definitely have your booster before you do it, because who wants to go in without the most protection possible from severe disease? The other thing is, when people say that, it means that they're not really thinking about the long-term potential impact of COVID. And we really don't know about Omicron and long COVID. So I'm sure many people have heard of long COVID. So there's a certain percentage of people who have, after they get COVID, for a long time suffer from symptoms and just aren't themselves again, even for years. And we know that even people who don't get really severe disease can get long COVID. And that's a concern. We don't know what happens with Omicron, but right now we could have many thousands of people in Australia who end up getting long COVID from this. And I wouldn't be going to a party to get it, because we really don't know what the long-term outcomes are of Omicron.
Nancy Baxter, always appreciate you sharing your insights on the show. Thanks a lot.
Bye now.